For many, this has been the year of the student. And so, to mark World AIDS Day, Eyewitness News is casting a special focus on how HIV and AIDS impact the youth. Research shows that in sub-Saharan Africa, young girls and women, particularly between the ages of 15 and 24, are 4 times more likely to contract HIV than their male counterparts. During the Fees Must Fall campaign, some students could be seen carrying around posters and placards, sending a message: Zuma, there aren't enough sugar daddies. But beneath the jokes lies a more serious problem, as the Seoul City Institute's Dr. Susan Goldstein explains.
We're particularly working with young women and girls from poorer areas. And there has been an increase of 34% of adolescent girls 15 to 19 had sexual partners 5 or more years older than themselves.
Health Minister Aaron Motsoaledi says his department is aware of this. However, there are many issues at play.
So most of the orphans we are having are maternal orphans, meaning it's their mothers who passed away. If your mother passed away when you are still very young, you usually lose your way out, your guidance. I'm deliberately saying mother, not father, because that's exactly what happens. When kids lose their mothers, when they are early on, even if they are left with their fathers, they usually lose guidance and they become vulnerable. Vulnerable to what? To vagaries like sugar daddies.
Motsoaledi says violence directed at young girls and women and persistent patriarchy contribute to the high levels of infections amongst the most vulnerable group.
But then the whole question of patriarchy around our country, where young girls and young boys are not treated the same, as you know. So we believe all those added together are producing this toxic mix, which leads to the problem of young girls between the ages of 15 and 24.
Just last week, UNICEF revealed that the number of teenage deaths from AIDS has tripled across the globe over the last 15 years. But at the same time, progress has been made in combating mother-to-child transmissions, with at least 1.3 million infections prevented since the year 2000. Goldstein says that the infection rates have also increased due to the fact that from the age of 15, young girls are sexually active and usually with much older men. Studies have also shown that men tend to be more promiscuous than women and less likely to go get tested for HIV. Now, given these study and doctoral insights, it begs the question as to whether or not there are effective measures that can help combat the spread of infection, especially amongst young girls and women.